I see people are jumping on, so it's great. Caitlin, good to see you. Glad you're here. Welcome to the next segment of our MetroEHS sponsored webinars and podcasts. We're really excited to share this information with you. My name is Karen. I'm the marketing manager at MetroEHS, and we will be sending this out as a recorded version to all the folks who registered. So if you can't stay for the whole thing, that's completely fine. We'll send it to you through email a little bit later. I'm going to turn it over to Deanna and Dawn and let them take it away.
Okay, so if you can make me the host so I can share my PowerPoint, perfect. I'll pull that up. My name is Deanna Coker. I am the Director of ABA Services here at MetroEHS. I am also a board certified behavior analyst. I have been certified for about 16 years now, and I have worked with kind of all ages and stages when it comes to clients diagnosed with autism, and I've had experience with several other developmental disabilities as well.
My name is Dawn Sterling. I am a board certified behavior analyst here at MetroEHS Pediatric Therapy, and I also serve as a regional director supporting Deanna. And I have been certified as a BCBA since 2018 and worked in the field of autism for much longer than that, as first a special education teacher turned BCBA, and have been doing work in the behavior analytic field since before 2018, but certified in 2018.
So today we're going to be talking about discharging from ABA services and what it looks like for your kiddo to have developed some classroom readiness skills. Maybe. Nope. Sorry, there we go. So today we're going to be talking about ABA therapy, kind of given a what, when, why, and for typically how long do clients stay in ABA therapy? When is it the right time to discharge from services? What does that discharge process look like? What kind of supports are available after ABA? And what are some of those skills that we're looking at when we kind of say our child or our kiddo is ready to go to school?
So the very first question that we get is, what is ABA? ABA is Applied Behavior Analysis, which is the science of human behavior. The science of understanding behavior is used therapeutically to assist individuals with developing skills, also known as behaviors, that are socially significant for them and their family. So especially when we're talking about children who are, we're seeking ABA as parents of children that have a diagnosis of autism. Why ABA? Families may pursue ABA therapy for a variety of developmental disabilities. However, ABA has proven to be exceptionally effective for those that are diagnosed with autism spectrum disorder. So frequently we are seeing children that have this diagnosis, while other diagnoses can benefit from this therapy. The most prevalent that we see is those with autism. So when should we pursue ABA? As early as possible. So developmentally, our milestones, if they are not being made, on time, based on, what your pediatrician's looking for, what you're expecting as a parent in terms of developmental milestones, walking, talking, all those things. So if you're noticing those milestones being missed as early as a year, 18 months, you're going to want to figure out if an evaluation is necessary. So we want to rule out anything, or if we do discover a developmental disability, then we want to make sure that early intervention is the key to long-term success and the shortest amount of time in therapy overall, which leads right into how long will my child participate in ABA therapy? And that answer is slightly different for each and every child. But the goal that we have is to assist your child in developing the necessary skills to be able to interact and effectively navigate their developmentally and chronologically appropriate environments. So think for 3 and 4, that's probably preschool or play groups. So if we're not able to navigate those effectively with minimal support, then therapy is going to target those skills. And when they start to reach those skills that match their developmental and chronological age, at that point, we may begin to fade to discharge.
Some of the skills that you'll often see worked on while your child participates in ABA therapy will be looking to increase functional and social communication. We'll look at increasing social interactions with peers and with adults, along with increasing interactive play with peers and adults. We look to increase independence with daily living skills. So if you think about things like eating or dressing or bathing or brushing your hair, brushing your teeth, potty training, things like that. We'll look to develop those school-based skills that are necessary to be really successful in preschool or kindergarten. And we'll also look to decrease problematic behaviors that interfere with accessing those new environments or navigating existing environments. So the new environments are thinking about that next learning environment. And the already existing ones are home. When they go out into the community, if there's some problematic behaviors there, we can work with the parent on decreasing those.
How long does my child usually receive ABA services? This is kind of a reiteration with a little more detail of what we're looking at different ages and stages. So early intensive ABA, this is why we urge parents to at early on, when you are noticing that we're not saying as many words as maybe we were expected to, or other gross motor milestones aren't being met, and having those evaluations, because we can begin early intensive ABA at an average age of 18 months to 2 years old. So early intensive ABA is typically 18 months to 5 years of age. And there's a range of 20 to 30 hours per week, typically, often in a center-based setting, so that we can also target social skills and group skills, and then those readiness skills to move on to a preschool type of program. Then we have what we call focused ABA. That's typically 5 years and up. So these are our kiddos that are transitioning into school. So they're not needing quite so many ABA hours, and the intensity it can be reduced. So this usually includes that systematic fading plan that reduces ABA hours to increase the time spent in the age-appropriate environment, such as preschool or kindergarten, and then transitional ABA. So school age through young adult, it's very few hours a week, typically focused very specifically on social skills and or independent living skills. And transitional ABA is often done in the home setting or via community living skills grouping.
Can my child receive ABA services after they transition into school? And the answer is yes. And there are a few scenarios where this would be considered necessary to continue.
Some of those scenarios are that we've transitioned into school and we continue to display behavior that affects our ability to interact with others or navigate a new environment with independence, and or impede their ability to acquire new skills. So if we've gone into school and some of our behavior in class is preventing us from acquiring the skills that we're working on in class, ABA might be used to support what is going on at school. Similarly, the next scenario is maybe we are in school and we're doing pretty well, but we need a boost with communication and social skills to fully transition effectively. Another scenario is that the child could benefit from in-home or community-based services that focus on gaining independence, and or if the child has aged into preteens, teens, and would benefit from social skills groups. Those are all options for supports outside of ABA and the school setting.
So to understand the when and how of discharge, we kind of look at how we structure therapy. So each client will have long-term and short-term goals that are being worked on during ABA therapy. All of these goals are going to be related to the core deficits of autism. Our short-term goals are the specific steps we take to teach a much larger skill. And those long-term goals are looking at that larger skill set that will set the child up for success in their next learning environment and in the future.
Long-term goals are typically the skills that are related to transition to that next learning environment. So these goals are typically the big picture goals that when you begin the process of ABA, we're talking about, short-term goals are those 3 to 6 month goals that we're going to break down into how do we achieve this long-term goal that is a big milestone. So a 4-year-old beginning ABA therapy, but we want to go to school by age 6 and transition to traditional school setting. So we have this 4-year-old who's not quite ready for that, but we want this to happen. So then we create the short-term goals that will lead to mastering that long-term goal. So some of the big picture items are decreasing reliance on one-on-one support so that when they go into a classroom setting, they don't look to have that adult right next to them or over their shoulder. Independence with functional and social communication so that they can make friends and keep friends while they're in their next learning environment. Overall social skills, so cooperative games like kickball, Foursquare is a game they play a lot in the local elementary schools, but being able to have these cooperative play opportunities, of course, decreased of any problematic behaviors that were preventing them from being able to access that next learning environment. Independence with activities of daily living, and then increased attending and ability to learn from the larger environment are some of the long-term goals that we will typically work on.
Mm-hmm. Discharge from ABA therapy should be a slow process. When a child is showing signs of skill growth and readiness, transition into the next learning environment. What works best for the kiddo and the parent. So a lot of times we'll look at if transportation is available during the day. So maybe we go to preschool in the morning and ABA in the afternoon. And if transportation is not available, we can kind of look to say, okay, ABA on Monday, preschool on Tuesday, and kind of rotate the week that way. If for whatever reason we cannot do that slow transition of splitting the schedule, then we really need to make sure we are preparing as much as possible for the child to transition into that learning environment. So we're going to look to really increase the frequency of our parent meetings. We're going to look to start to schedule and attend meetings with teachers and the IEP teams. And we also really want to look at the goals for the current ABA therapy to make sure we are working on those skills that the child needs to be successful to move into that next environment. And the most important thing really to remember is that the goal of ABA therapy is a successful transition into the child's next learning environment. It's not to always need ABA therapy. It's really to gain the skills necessary to go to the next environment and then the next one after that and after that.
Where can my child go after ABA? There are lots of options, but typically once children fully transition into the school setting, there's no need for additional ABA therapy most often. However, in some cases, a child will go to school and attend ABA services at the same time. That might be that split schedule Deanna mentioned. It could also be a transitional ABA program where we just have a few hours that we're attending home-based provider. Alternatively, some kids go on to go to school and they join school sports team or community sports teams or community groups. They get involved with things at the local library or their neighborhood events. And then other children and families will continue to receive support from other therapy providers, mental health professionals, or outpatient occupational therapy, physical therapy, speech therapy may also be continued depending on each child's individual needs.
So when we start talking about some indicators that your child is showing school readiness skills, what are those skills specifically that we're looking for?
A big one is the communication skills. So what we are looking for is the primary ability to communicate wants and needs with minimal support. So what that means is that either we are vocal, verbal, and can tell everybody, hey, I need some help, or can I have a snack? Or with use of an AAC device, that's an augmented device for communication, where as long as they have mastered being able to use that device to communicate those wants and needs without needing prompting or reminders to do so, that is one indicator they might be ready to start moving on to a next environment. Also the ability to verbally or via the device state some personal information for safety reasons, like their name and age, maybe a little bit beyond that, like mom or dad's phone number as well, depending on age and skill set. And then also the ability to receive communication. So we talked about being able to express our wants and needs and safety information, but also the ability to receive information. So can I follow 2-step instructions? Am I able to, as a listener, identify body parts, common objects, people? Once we're showing indicators in all 3 of those areas, it could be a sign that we're ready to begin the process of transitioning to school.
Some of the skills we look for in group settings. So we really like to help kiddos gain the ability to wait in a group and also walk in line with the other children that are going to be in their class, sit appropriately in a group, and attend to a story or an activity that may be taking place in front of them or presented by a teacher that's kind of off at a distance. We really like to work with kiddos on orienting their body towards whatever is going on. Participate in cleanup activities. So this can be anything from academic materials to play materials to lunchtime and snack materials. Attempting to complete teacher assigned tasks. So can they independently initiate and engage in a task that was just given to them? Can they choose a free choice activity and then complete a free choice activity? It's a bigger skill set of really being able to fill their time independently. And do they engage in minimal disruptive behavior? And this goes back to what Dawn was just talking about with the communication. Can they communicate clearly when they need help from somebody or something from somebody without engaging in disruptive behavior?
We also take a look at the daily living skills that would be needed to be successful in an environment where we don't have necessarily one-on-one support. So one of the things we look at is the appropriate bathroom skills. So are we toilet trained? Are we independent with being able to get our clothes up and down, or at least be able to attempt to dress ourselves in any capacity? Are we able to follow the familiar daily routines? So do I know to put my things away in my cubby and retrieve them at the end of the day? Do I know where to put my snack or lunch and how to go about handling snack or lunch in a group? So I'm able to sit with them and eat my own snack and also not reach across the table and grab someone else's, or just being able to demonstrate the expected behaviors in environments where daily living skills are the expectation. So lunch, snack, bathroom, even, like library skills at school, or being able to successfully navigate that academic setting, and that I sit down for a little while and I'm able to do some things that require the fine motor skills that relate to tasks of daily living.
Some pre-academic skills we look for. Can the child count from 1 to 10? And also, can they do one-to-one correspondence where they understand if I have 3 of something, it corresponds directly to the number 3? Can they label numbers when they're presented to them? Can they identify, match, or sort objects just based on typical categories that we see within the world of animals go with animals, or cats go with cats, or we sort things by the color orange? demonstrate emerging concepts of print. So can they recognize their printed name? Schools rely heavily on the use of printed names to identify where kiddos can put their stuff or where all of their academic materials are located. They're usually labeled with their name. Can they recognize and identify letters of the alphabet and basic colors? And can they recognize and sing and participate in basic songs that we use throughout preschool and kindergarten?
Continuing on with some of those pre-academic skills, are we able to hold scissors appropriately and at least have beginning cutting skills? Can we write our name? It's not always a requirement to be able to write your full name, but it's a good idea to have a start for that. Engage with sensory material in a safe way. So preschool environments and kindergarten and beyond may have sensory tables with rice or kinetic sand or other materials. So are we able to interact with that without putting things in our mouth or engaging in an otherwise unsafe behavior? Are we also able to complete simple manipulative activities? We sometimes call them leisure skills or independent playtime where an adult does not have to consistently monitor you. So can you sit down with a puzzle and complete it without additional prompting? Can you do stringing of beads, building of Legos, things of that nature? Can you engage in painting, coloring, something of that sort with some independence?
Some gross motor and larger motor play skills that we usually look for are a child's ability to use the playground equipment safely and appropriately. And can they participate in group movement and music activities? Are they able to run and balance and jump? Are they able to throw balls or kick balls or just participate in large ball games if there are those materials brought out to them? We're really just looking for them to have knowledge of these items, being able to use them safely. And also, and a big added bonus is that they know how to participate with others while using these items.
So we want to have everyone remember this at the forefront of everything, that during this process, you're going to want to remain to working closely with your BCBA and any other therapist that you are seeing. So if your team includes an OT, PT, SLP, and that school-based team that you're transitioning to, we want to have the whole child represented. So every service provider and then the team that they're transitioning to are part of the discharge process to ensure that there is a smooth, successful transition for your child. For more information about that whole process of what the school will start with and the IEP process, that individualized education plan, please check out our next webinar to learn more detailed information about that process.
Are there any questions that we can answer?
That's what I was going to say, Deanna. Thank you, Dawn. Thank you, Deanna, for your work in putting this together. This was such great information for all of us. I appreciate it. If you do have a question, you can either pop it in the chat right now or raise your hand and we will try to get it answered. Otherwise, like they said, please stay tuned and look for details about upcoming webinars sponsored by MetroEHS. We're going to have one on IEPs coming up, which is really important for you to pay attention to, especially over the summer as we go into another school year coming up sooner than we know, right? We'll also have other webinars on OT and different things. That speech, for example, is probably coming up soon. So please stay tuned to the Metro social media and we will give you more details on those upcoming events. We thank you so much for tuning in today. And since I don't see any questions coming in, I guess we can just put a pin in this one. Pay attention to your email. We'll be sending out a recorded version of this coming soon. Appreciate you all, and we'll see you next time. Thanks, Dawn. Thanks, Deanna.
Thanks.